Well, good afternoon and welcome to South Australia's special COVID update. Today I'm joined by the Honourable Stephen Wade, the Minister for Health and Wellbeing in South Australia, Professor Nicola Spurrier, the Chief Public Health Officer, and Commissioner Grant Stevens, who is also the State Coordinator during this major emergency declaration. I've long said that COVID has challenged us, but it has not beaten us. We continue to face our biggest test to date. We can and we must rise to this challenge. And rise we are, each and every one of us, united with a common purpose to beat this silent enemy. Record testing rates, proud South Australians in line for hours to be tested, knowing that the effort of each and every one of us collectively makes a big difference on how we get through this. We have world-leading health experts and world-leading health systems that have helped to keep South Australia safe and strong. No effort is being spared to stamp out this virus in our state. We are going hard and we are going early. Time is of the essence and we must act swiftly and decisively. We cannot wait to see how bad this becomes. We must act swiftly and decisively on the health advice to stay ahead of the game. That health advice is that we need a circuit breaker. We need a circuit breaker to stay ahead of this. We need breathing space for a contact tracing blitz to protect the elderly, to protect the vulnerable, to protect our entire community. That is why today I'm asking you to rise to the challenge again. As of midnight tonight, we need our community to pause for 6 days. A series of wide-ranging restrictions will be implemented to significantly reduce mobility in the community, to stop this spread, to stamp out this virus. The Police Commissioner will outline these shortly. I acknowledge that these restrictions will be challenging for South Australia, but we can and we must follow the expert health advice to keep South Australia safe and strong. It is important that I make the following points to walk people through this. We have caught this cluster very early. We know where the links to this cluster are. We have an opportunity to stop the spread of this disease and to stamp out this cluster. We need to continue to move very quickly. We need the opportunity to identify and isolate the close contacts so that they aren't out circulating the virus further. Pausing community activity will significantly reduce the risk of the virus spreading further. Our contact tracing team are working around the clock to track down every contact to this cluster. We are getting additional contact tracing support from the Commonwealth, from Western Australia and also from New South Wales. But we need this circuit breaker, this community pause. This is about South Australia pausing so that we stay ahead of the virus. Our concern is that if we don't have this circuit breaker, that we will not stay ahead of this. There is no second chance to stop a second wave. We are at a critical point, but we will get through this. We may be physically distanced, but South Australians have never been more united. Together, we will get through this because South Australians are strong, they're resilient, and they're united. I'll now pass over to the Police Commissioner, who will outline the restrictions, and then we'll pass over to Professor Nicola Spurrier to give us more details about this cluster and our genuine concerns about precisely what is happening. Can I also let people know that ahead of this press conference I have informed His Excellency the Governor of our intention and also the Leader of the Opposition, Peter Malinauskas.
Thank you, Premier. Can I start by saying that as the State Coordinator, I've challenged the Control Agency, SA Health, on the need for these significant impositions that we're about to place on the community for a relatively short period. And I am 100% supportive of the approach that's being taken. The changes that are occurring now as a circuit breaker are quite comprehensive and will have an impact on virtually every member of the community. What I'll do is I'll just explain some of the areas that we are going to be closing or shutting down for a 6-day period, and after that 6-day period there'll be a further 8 days of other restrictions which will not be as significant as the ones I'm about to outline. This is not yet a complete list. South Australia Police, along with SA Health, are working to consolidate this list. This will give a very good indication of the extent of the changes that we're making, but we will be providing further information during the course of the afternoon, which will give everybody sufficient clarity to understand exactly what changes we're making. Things that are being closed or shut down effective midnight tonight are all schools except for children of essential workers and vulnerable children. Takeaway food will be shut. Universities will be closed. Pubs, cafes, coffee shops and food courts will be closed. Elective surgery, except for urgent operations and cancer treatment, will be closed. We are closing open inspections and auctions for real estate. We're also closing all outdoor sport or physical activity. FIFO workers will be on standstill for 6 days. Regional travel is not approved. If you are in a location at the commencement of these restrictions, you'll be required to stay there. Aged care and disability residential care will be in lockdown. Factories other than food and medical products will be closed, except for where it is necessary for them to remain open to prevent damage to machinery. The construction industry will be closed for 6 days. Holiday homes will not be available for lease or rental. Weddings and funerals will be banned for 6 days. Outdoor sport is not permitted. Masks will be required in all areas outside the home. Some of the areas that will remain open, which will be considered as essential: critical infrastructure, including water, power and telecommunications, will be able to function. Supermarkets will remain open to provide access to food and essential products. There will be limitations in terms of access, providing specific access to vulnerable members of our community to ensure they can access goods and services. Medical, including mental health, supplies, access to services will be available. Public transport will be open. The airport and freight services, including courier services, will be able to operate. Petrol stations, access to financial institutions and post offices will be able to be accessed. Mining, smelting and large factories will also be able to remain open, but only those parts of the facilities that need to operate to ensure continuity of service delivery or to prevent damage to the plant. Childcare will be available only for families of essential workers, and the minimum operations of government, including local government, will be permitted to operate. Veterinary surgeons will be able to remain open. People will be restricted from going out of their house for a 6-day period. The message is stay at home unless you are accessing essential services or you are an essential worker. Exercise will not be permitted outside of the home for a 6-day period. Food purchases will be available. You will be able to leave one person per household once a day to access groceries. Agriculture will be able to move about to ensure the safety and welfare and processing of animals and the production of dairy and other agricultural services. End-of-life visits will also be available through organised arrangements. That's the list as it stands at this point, but I stress we are still working on the final list in terms of what those restrictions will be and what will be allowed to operate, and we will be updating further into the afternoon and evening as that list becomes available.
Commissioner, did you ever think we'd get to this point?
I have to be honest with you, I suppose there was a time during March, April when I thought that the advice we were receiving from health, the trends we were seeing overseas, certainly led us to consider these types of restrictions. But with the way we've been able to manage COVID-19 over the last few months, I must admit this is something that we didn't anticipate. It's something that we've got contingencies in place for, but I think it's important that we take these steps to ensure that we can support SA Health as much as possible to eradicate this virus.
Commissioner,
We are going
Sure.
to
Yeah.
Professor Spurrier, and then we'll do questions after.
Thank you. So I will give a brief update to where we are at with the cases here in South Australia, but I also want to outline the rationale for why we are doing what we're putting in place today. But I'd like to also, first of all, thank every South Australian for coming with us on this journey. We need to stamp this virus out at this point. We haven't had it in our state for many months, and we need to get back to that wonderful place where we could enjoy the things that we all enjoy. Unfortunately, we now have it in our state, and this is what we must do. So since yesterday, you are possibly expecting me to give you a very large number of cases, but I'm not going to. I'm going to give you a small number of cases. It's small but critical. So today we have 2 new cases. Both are linked to the Parafield cluster. So most importantly, we have been able to link all of our cases to date. To date, there are 22 cases linked to that cluster. There are also an additional 7 people who are either awaiting test results, or we had an initial test that was negative, but we're highly suspicious and we're treating them as infectious. Due to the high risk of onward transmission in the community, all of those suspected cases, as I explained yesterday, are going to be treated as infectious, and we've put the public health in train as a precaution. The other thing, before I explain the rationale for our decisions today, I want to give a really strong advice, because this is very, very important. Anybody who got takeaway delivery from Woodville Pizza Bar, 58 Woodville Road, Woodville, between the 6th and 16th of November, so that's a 10-day period, must immediately self-quarantine and get tested. Okay, so that is really, really important information today. They must go directly to the testing location, wear a mask, and alert the staff that they've visited the pizza bar. We're in the process of working through credit card details so that we can directly contact those people. But it's at a critical stage in our investigation. We really need to make sure all of those people are aware. So if you have people and friends and family living in Woodville, get hold of them now and ask them, have they been to that pizza bar? And all of those details are on our website. Now, this is still very early days in this cluster, and I want to talk you through the rationale of why we're asking every South Australian to do this at this point in time. All of the cases, as I said, the positive cases, have been linked, and that's a phenomenal effort, and it means that we are very early at the beginning of this, and we have a very, very short window of opportunity to close it down and stamp it out in our community. This particular strain has had certain characteristics. It has a very, very short incubation period. That means when somebody gets exposed, it's taking 24 hours or even less for that person to become infectious to others. And the other characteristic of the cases we've seen so far is they've had minimal symptoms and sometimes no symptoms, but have been able to pass it on to other people. We also know, because of that characteristic, that what we call a generation is only about 3 days. And a generation is when one case is passing it on to the next level. And then that level, so that if they pass it on to 2 people, they'll pass it on to the next lot of people. And that's your 3rd generation. At the moment in South Australia, we have done all the contact tracing up to the 4th generation. But the 5th generation is out there in our community, and at the moment we are contact tracing to get onto that 5th generation, and that's the call out for the Woodville Pizza Bar. So the reason for going for this 6-day period of really significant restrictions is that's 2 generations. As I said, we're up to the 5th, and then we'll be getting up to the 6th. We don't have any time to wait. If I just thought about this all day and then told the Police Commission, the Premier, to tonight, we would already be that 12 hours behind. So we really do need to act fast on this. So that's the rationale. The information also that I got last night cements my concerns. So a little bit more information about these cases. So the one case that we received information about yesterday midday was of a young man who works at one of our Medi hotels, but it was not the Peppers Medi Hotel where our other 3 cases have been. It was at the Stamford. And in fact, this person wasn't a security guard, wasn't a nurse, and wasn't a police officer, but worked in the kitchen. And that made us very concerned, because we couldn't work out how on earth had that person become infected. You know, how were those 2 Medi hotels linked? And people questioned me afterwards, did we have staff working across, and should we have done that? Well, what happened last night was that we made the link. So we had a close contact of one of our security guards who actually was working part-time in the pizza bar, And the case we got last night also worked in the pizza bar at the same time as the person who was at the Stanford went and got a pizza. So we absolutely have linked all of that. We will get the genomics to prove it, but we are absolutely certain with our history taking that that's what's happened. And that means to me, when I saw this, it cemented my fears that this virus is breeding very, very rapidly. You've got a short incubation period and you've got 3 days as those generations move on. So I know this is an absolutely big ask, but if we leave this any longer, and if we have people moving around the community and having a lot of contact with other people, then we're going to be in this for the long haul, and we will be like the experience in Victoria, where we get increasing cases every single day and we have to go into a significant lockdown for a very long period of time to snuff it out. And to get rid of every last bit of community transmission. So this is a different strategy to what has happened in Victoria. And I guess there'll be other public health physicians and epidemiologists and other specialists around Australia who'll be looking at us and saying, gee, they're doing things a bit strange there in South Australia. We did it differently here in Victoria. But I am using the science, and I'm also using the information that my team already has got from our experience here. And I know that this is the right thing to do. I can't be making this decision in 2 or 3 weeks' time or even 2 or 3 days' time because it's going to be too late. This is going to put a lot of strain on many people, and this is the time to be patient, to be calm, and to trust in people that are there to support you. We all need to look after each other. It's no point panicking and rushing out to the shops and, buying up lots of toilet paper. We've got to be looking out for other people. And my advice is, if you've got vulnerable members of your family, so elderly people or people with chronic conditions, you give them a call and say, I'm going to be there to look after you and help you out for the next 6 days. And what can we do to support you? And that's the sort of community spirit I know that South Australians have. So I'm very happy to take questions, but I'm hopeful that I've been able to explain where we are in South Australia and why we are doing it this way.
Professor, what about people that are getting tested? What do they need to do and how do they keep safe in these really, really draconian restrictions?
So the one thing that we definitely want people to do is during this 6-day period is to get tested, but we are going to prioritise our testing, and we are going to prioritise it so that people who have been told to get tested by CDCB, we want them to be the priority, and we're working out a plan to make sure that that happens. The next priority is people who have been to any of the sites on our website, and that has been clearly, put up on our website exactly what you need to do if you are in a particular category. Those people with symptoms we need to have tested. Going down the list from that, of course, we want anybody in our community who has symptoms to be tested. What we don't want at the moment is for people with no symptoms and no link at all to any of those venues or places of concern. We don't want panic testing, because that will just block up our testing sites. And I know that there have been very, very long queues at the testing site, and I thank you so much for your patience, because the fact that you've stayed there for 5, 6, 7, 8 hours to have that done means that we will get ahead in South Australia.
Professor, has it been confirmed that the initial virus was picked up by surface contact, and if so, how significant would that be for your understanding of the virus?
So right at the very moment, my concern is getting on top of this. So we haven't done the full investigation. We know that there were 3 people at the Medi Hotel who are positive. We've got a suspicion who might have been the first case, but we haven't gone back to the CCTV footage in any detail to see if we can make that connection. It is actually very important, and so we will have a team, particularly helpful is our SAPOL colleagues, to try to get to the bottom of it. But in essence, for me at the moment, that's an academic question, and we need to get on and stop the ongoing transmission.
Professor, you talk
on that, whether the initial traveller at the Medi Hotel who would have brought that strain of the virus had any relationship or was related to anyone at the hotel?
No, there's absolutely no a suggestion of that whatsoever. We know that the person who where genomically is linked had travelled from the UK.
Professor, you're talking about testing. Has any further consideration been given to extending the opening hours at the testing centres further? And are you potentially moving towards 24-hour testing in some locations?
Yes, absolutely. We have had a significant number of people come together, put their heads together on this morning, and we are also looking at bringing in resources from interstate because we're very good with our lab capacity, but it's actually getting through and doing all of the testing, and we need more people. But you need to be trained to do it, and you need to know how to use PPE. So we will be putting out further information today about that extended testing.
With the pizza bar infection there, how do you think these people have come to catch the virus?
Look, it's too early to tell. We know when there's a lot of the disease in a community, for example, what's happening in Europe and the UK, it is mainly droplet transmission. So when somebody is standing close to the other person, but there are very definitely cases of fomite transmission or surface-to-surface transmission, where somebody who's touched, had infected secretions has touched another surface and somebody else has touched it and then touched their face or eyes. So we definitely know it can happen. In a time when there's a lot of disease around, it's probably mostly droplet spread, but in our circumstances where that isn't the case, it's definitely a consideration. And I know, because I have a lot of detailed conversations with my colleagues both interstate and also in New Zealand, that there are very, very definite confirmed fomite transmission cases.
Professor, we saw you walk in with the Premier and the Police Commissioner wearing masks. Most of us here today are wearing masks. What is your advice to South Australians at home watching this right now?
We will be looking at having more stricter conditions for wearing masks, but we know that it takes people a little bit of time to get a mask. Now, we're using disposable masks in here today, and you need to be able to wear a mask correctly. So one of these surgical masks you can only wear for about 2 hours before you need to change it. So if people are watching this, I'd like you to get online and have a look at other ways of having the non-disposable masks or cloth masks, which are also very effective. People who are handy with the sewing machine may be able to run some up for yourself and for your family and friends, but also we are looking at the distribution of masks across our state.
Professor, the Woodville Pizza Place.
Children as well?
So of course it's very difficult, particularly for younger children, to wear masks, and as a paediatrician, you know, I wouldn't expect a 2-year-old to keep their mask on for very long. The other thing about children is we still, it is still the case that the transmission rate is not so high between children, but certainly older children will be encouraged to wear masks.
The Woodville Pizza Place is on several food delivery apps. How concerned are you that this virus has spread through several restaurants across Adelaide?
This is a very significant concern to me, and this is why we're putting in place, you know, one of the reasons we're putting in place the restrictions as we are doing today. Of course, it's not just the Woodville Pizza Bar. There have been other people who have been out or may have been out and about infectious that we haven't been able to catch up with, and that's the reason for asking every South Australian to go to our website and follow the instructions. If you have been in any of those places listed, you must go home.
You mentioned on testing as well, we're trying to bring in people from interstate. How many extra staff in South Australia have been deployed on these testing clinics?
We're just working through those numbers at the moment, so we will be able to update you later.
Professor, you also yesterday gave us an indication there was some 4,000 South Australians in self-isolation. Are you in a position to provide us an update as to how many people today are in that circumstance?
Look, there's certainly more than that. We were ringing and giving information to all families at Roma Mitchell College, and so there's a significantly larger number. There's also been other additional exposures, and I was helping out making some of those calls last night to make sure that the message had got through to people. So I haven't got an exact number. Of course, it's very nice to be able to tally up numbers and provide that to you, but really our focus has been on getting hold of those people, letting them know and getting them into quarantine.
Have a significant number have to be put in hotel quarantine because they can't safely quarantine at home, and how many might that be?
So we are, of course, trying to have more home-based quarantine, but there will be a number of people that are not able to do that safely at home, and we're looking at other options for them. But again, I don't have those numbers.
Professor, when we locked down earlier this year, you were quite adamant schools should remain open. Why has that advice changed in this instance?
So this is quite a different situation. At that time, we had a number of different strains introduced into our state from international travellers, and also when we looked at the way that those strains of the virus were spreading in our community, it was a little bit slower. And also because they were international travellers, it gave us a chance to find them because it was obvious that we were looking for people that had had international travel. This is quite a different situation. We are really at the beginning of this in South Australia, and I need everybody to basically find a safe place to be for the next 6 days and stay there as much as possible. Whether this is, you know, a Netflix blitz for some people, and I know it's going to be really difficult for many people, but we just all need to be doing it. So it is quite a different situation to that which was posed earlier for us here.
You talk about a 6 day hard lockdown. How lots of people are already talking online about surely this is going to be extended beyond 6 days. How confident are you that it won't go beyond that?
So for this initial period is 6 days, which is, I would call it a circuit breaker. I mean, it really is extreme. And then after that, we need 14 days in total in terms of the incubation period of the virus and the number of generations. So we've had to sit down and mathematically work it out. So for a 14-day period, there will be significant restrictions, but it will not be, my hope is it should not need to be what we're doing for the 6 days.
We're obviously
Christmas
entering
is
a
off.
very busy social time, Christmas parties and the like. Is your advice that work Christmas parties are cancelled, and what should people be doing if they were planning to go interstate?
At the moment, in terms of the interstate travel, for definitely these 14 days, I do not want to be taking this virus or being responsible for taking this virus to other states. Now, I know people may have made travel plans, but there are restrictions to entry into many of the other states in Australia, and I have a national responsibility as well. So I'd be asking South Australians to stay put. You know, we're going to work together on this as a community. So I'd like to see very limited movement between states at this point into and out of South Australia.
Professor, can I just clarify, please, the Woodville pizza shop? How do we think that the virus actually got to the Woodville shop? Is it from the Medi Hotel security guard? Is that what?
Yes. So one of the security guards in our Medi Hotel, like many people, had more than one job and worked part-time at that pizza bar.
Professor, can you
setting up
please-
any specific testing sites for these high-risk locations, or encouraging any of these people to go to a specific location to get tested, so to essentially save,
Yes.
protect the others, or fast-track it?
Yeah, no, that's absolutely what we're doing. We know that some of these people turned up to our other testing sites and couldn't get tested, and then would have to go back the next day. So that is our absolute top priority today.
Can you
So,
confirm?
sorry, you are setting up a specific
Yes.
location for them?
Yeah.
Where is that going to be?
I haven't got those details because I've just come out of that planning conversation, but as soon as they're available, we'll be getting that information out.
What's
The
happening
cli-
with the major shopping centres, the Myers and Westfields and that kind of thing?
So as the Police Commissioner outlined, we need to stay at home as much as possible. So my expectation is that it will only be the most basic supplies that are going to be open, and that is for people, it is getting food. It is getting medical supplies and pharmaceuticals. So we will not be having our major shopping centres open. Of course, if there happens to be a supermarket there, we of course will need to keep that open.
Professor, the Prime Minister has been adamant that he wanted the country open for Christmas. Based on my very basic journo maths, the dates that you provided us, we're getting very, very, very close to Christmas with these restrictions. What is your medical expert opinion about how Christmas is going to be celebrated this year?
Look, it's too early to tell, but this is really the one chance we've got of going to having a normal Christmas. And if we leave it too much longer, then that chance disappears. So the virus unfortunately doesn't understand our public holidays or our religious festivals, and it doesn't understand that we've got, Christmas coming up. Let's just focus on the here and now, what we all need to do in the next 24 hours to stay calm and patient and work out how we're going to be safe and how we're going to support other people for the next 6 days.
Can you confirm whether the cleaner who worked at
Medi hotels, like how was a security guard at a Medi hotel allowed to then go work in a public pizza place? Is there new rules that are going to be restricted on the jobs in Medi hotels?
So look, really, we say in medicine, look, it's very clear with the retrospectoscope. So, you know, when you look back and you think you could have done X, Y, Z. But actually for me today, I'm looking forward about what we have to do here and now to get on top of it.
Can you clarify the Stanford connection again, because that is quite confusing. Did the Stanford worker work at the pizza bar too? Or
Yes, yes.
Right.
But we couldn't make the link because, no, hang on a minute. No, so the Stanford worker didn't work at the pizza bar, and it is confusing. So I'll just go back through it again. So we had a security guard at the Peppers Hotel that worked part-time making pizza, and we had the person at the Stanford, and we couldn't connect the two. But what we found last night was another person that worked at the pizza bar, and we were able to connect those two up because the time links.
The Roma Mitchell Secondary College is closed till November 30. Is there any particular reason why that's closed for so long?
Yes, so we have done a risk assessment of all of the schools where we've got either absolutely clear infectious cases and we've got some suspected. And so at the Roma Mitchell School, it was an older person, it was an older student in her teens who was clearly infectious when she attended school on Thursday and Friday last week, which was the 12th and 13th. She didn't attend over the weekend, but because of her level of infectiousness, we have put a stronger quarantine requirement on that school.
Can we just confirm that it is the entire state involved in these restrictions and not just Adelaide?
This is the entire state. We don't have a ring road or a circle of steel that we can put in place. And the other thing is, I don't know if somebody who went and got a pizza at the Woodville Pizza Bar then went and travelled, somewhere into our regional centres. So this is applying to everybody in South Australia, and we're all going to do this together.
Can we get a condition update on the 2 patients in hospital?
They're stable.
The regional travel ban, Professor, is that similar to what we saw earlier this year? How enforceable would that be?
Look, I'll need to pass over to the Police Commissioner, but basically we want people for the next 6 days to go home, make sure they've got their supplies, and to really spend as much time in that one place as they possibly can, leaving just for essential food, essential medical requirements and the like, but really trying to stay put as much as possible.
Professor, just to clarify before we move on to the Police Commissioner, is it still only the 2 people that you're aware of with COVID-19 in hospital, or have others been taken to the Royal Adelaide as a precaution as well?
No, we've just got those 2 patients.
Professor, can you indicate how many close contacts of anyone, the guards and the kitchen hand who went to the Woodville pizza shop?
I don't have those numbers because, of course, we're at the moment trying to trace that, and what we're doing is working with our police colleagues and getting credit card details, but that's going to take us some time. That's exactly why I've asked people to, text, get onto social media. Have you been at Woodville Pizza Bar between these dates? I need all of those people identified as quickly as possible, and if we can do that through social media with some help from all of you in South Australia, that would be terrific.
Can you confirm
on home gatherings? I know it was a limit of 10. Is that now back to only people who live in the house?
Yes, that's exactly right. So you need to all be thinking about where you're going to be for the next 6 days, where would be the most convenient for you, where you can look after your loved ones, and make those organisations and make those decisions now.
So no family, like grandparents or aunties and uncles, it's just immediate family?
That's absolutely right. So if you have grandparents that are elderly and are going to require some care, then my suggestion is you try and make some arrangements for you or somebody else to be able to provide that care.
the cleaner who tested positive at Peppers, did she also work at Anglicare, the aged care facility where there have been positive cases?
No, so, but they're all part of the same family. So you had the two older people, and then there was a series of children, and there were two people within that large family group who worked at Anglicare. So no, that wasn't the case.
Professor, I asked the Commissioner earlier if he envisaged this would happen. Did you think we would get to this point?
Look, obviously, in the early days, we thought we would have this one large wave, and we had no idea how long it would last. I was really surprised it was only very short, and we managed to suppress it very, very quickly and get on top of it. I was also very surprised that we didn't have little pockets in our community that popped up from time to time. But clearly, if it is reintroduced into a community, it takes off very quickly. And that's exactly what had happened in Victoria. I don't want that to happen here in South Australia, and I'm going to do everything possible to make sure that it doesn't happen.
So are we defined in the second wave now?
Look, it depends what size you think a wave is. I would really like to not have any further cases here, but I think it's inevitable that we will. But I want all of those chains of transmission to stop. And I want even people that may be infected, that don't even get symptoms, to have been, for it to burn out before they get out and about again in the community.
Commissioner, can we ask how on earth are you going to police all of this?
Well, as we've said before, policing can only provide so much in terms of providing a safe environment for the community. It relies on the community doing the right thing and supporting each other. So our expectation is that people will do the right thing. They'll abide by this extreme level of imposition for a short period of time and help us do our job. Clearly, if you're out and about during these 6 days, you should have the ability to justify the reason for your travel. We will be out there and we'll be making sure that people do the right thing.
What are those reasons for being out of your home?
It will be. As I said, we will provide more detail in relation to the specific restrictions that are going to be put in place and what people are able to do. But essentially, you are required to stay at home for the next 6 days. You may leave home. One person from a home may leave once a day to obtain groceries, supermarket supplies. You may leave to provide care and support for another person where it's essential, medical services, but we will provide specific detail on that later on this afternoon.
Do you have any numbers on how many checks have been carried out on the 4,000 plus people?
No, I don't. I do know that the SAPOL team doing compliance checking have been prioritising that and have been making visits. We've always had a very large number of visits done every day, and we've been maintaining that, but we essentially put the resources where we think we can get the best value.
What happens to people who are currently on holiday in regional SA?
People who are currently on holiday should be making a decision as to where they're going to be for the next 6 days. They have until midnight to make that decision and then find themselves in that location.
There was 96 police officers self-isolating. Has that number increased at all?
At the time of reporting that, that was correct. My understanding is we had 99 police officers from the cluster associated with Peppers, and as a result of activity at the Lyell McEwin Hospital, there were a further 18 police officers who were required to quarantine. We're working through with those officers in terms of their exact movements at the Lyell McEwin, and a lot of those officers are expected to come away from quarantine quite quickly. And as for the officers involved in the Peppers, essentially most of those are likely to have to do the 14 days quarantine.
So that's 99 for the Peppers and 18 for the Lyell McEwin?
Correct, yes.
How is it that we had a Medi Hotel worker also working in another venue when that was a finding in the Victorian Hotel inquiry that shouldn't happen?
Are you talking about another Medi Hotel or doing secondary employment?
Yeah, so we had a worker in a Medi Hotel also working in a pizza place.
Well, we've had no restrictions in relation to, and it's difficult for us to impose those sorts of restrictions. We are relying heavily on the security industry, and they are supporting us to a substantial level to ensure that we're maintaining a safer possible environment in the Medi Hotels. But we don't have other restrictions on other people working in those facilities. We can't quarantine these people when they're not at work. They're able to participate in normal community activities. Now, whether that's participating in sport or taking on another part-time job, the level of engagement with the community in terms of how they do that is irrelevant. We can't quarantine these people simply because they're assisting us by working in quarantine hotels.
Commissioner, are you looking to...
Have you been requested or made requests of extra troops from the ADF? How many?
We submitted a request to the Commonwealth yesterday, and As a result of that request, an additional 45 Defence Force personnel were committed immediately, with the offer of an additional 45 should we need that. And we're now assessing just how we may be able to utilise that, and if we need to do so. We won't call upon the Defence Force resources unless we specifically need them.
Just on that, are you going to need to flex up any further Medi-Hotel capacity over the sort of 6 and then the 8-day period, just in case, to handle any further increase in cases in South Australia?
Yeah, we'll take advice from SA Health on that. We are restricting international arrivals, which does give us significant capacity in our Medi-Hotels, and we are doing that so we can accommodate local requirements and ensure that we quarantine those people who need to be quarantined who are testing positive.
Commissioner, you've talked ad nauseum about education and second chances that you're giving people. How are you going to police these new restrictions going forward?
Look, our approach will not change. We expect people to do the right thing. We are relying on people to do the right thing. We will support the community as much as we can, but once again, if you deliberately disobey these restrictions, if you essentially ignore the advice that you're given, then you should expect that we're going to take action. But we don't want to do that. We want to work with the community. Everybody's in the same boat, so let's work together and make sure that we get through this together. Can I say on that point, this afternoon is going to be a particularly challenging time for our retail outlets. Supermarkets are going to be open beyond today. There is no need for people to rush to supermarkets, and if you do go shopping this afternoon, then you should expect that you are going to be managed by staff at the supermarkets, and we will have police officers on standby to attend if we see any civil disorder, and we will be taking action. This is completely unacceptable. There is no need for panic buying.
Can I clarify what the restriction is as well around exercise and people leaving their home to do that?
There is no permission to leave home to exercise for the next 6 days. When you are at home unless you are leaving for essential services.
So we cannot leave the home?
You cannot leave the home for exercise.
I know this is going to sound like a relatively silly question. Schoolies is off as a result?
Well, I think Schoolies is an indication of where we thought we were in terms of South Australia managing COVID-19 or working in a COVID-19 environment. We were optimistic about being able to provide an opportunity for our Year 12 school leavers to celebrate to some extent. This is a changing dynamic. School leavers will not be able to participate in those celebrations now. They must be at home or at a place of their choosing for a 6-day period. They won't have the ability to move between residences or go to holiday houses. Holiday houses will not be available for rent.
Do you anticipate the 6-day lockdown to be extended?
Well, we've had significant discussions with SA Health this morning. I'm confident, based on the advice we've been given, that we are doing this for 6 days and then we are moving into a period of significant restrictions, but not to the same extreme level that we're talking about now. We are aiming for that, but as with everything we've said about COVID-19, we don't control this virus. We're doing the very best that we can to manage it and to eradicate it from our community. But if we need to take other steps to keep on top of this, then that's what we'll have to consider. But the plan is 6 days of significant lockdown, moving into an 8-day period where we make some relaxations, but we still keep things tight so health can do their job and get on top of this.
Can you elaborate what that 8 days would look like? What hope can you give the community?
Well, I think we should be looking at what was happening in Victoria just a few weeks ago. That's probably the level of restrictions that are going to be thrashed out. We will make some concessions after the 6-day period, but the 8 days following that will still have some level of significant restrictions so health can do their job. They can do the contact tracing, they can get across this virus and eradicate it. The period of time we spend contained within our homes is critical for this virus either to be identified or to burn itself out.
Commissioner, just in terms of families with joint custody, children, that kind of scenario, in terms of dropping off, picking up, how is that likely to apply?
Well, ideally, we'd be asking those families, and I know this is a difficult situation for many families, but we would be asking those families to make arrangements that see them getting through this 6-day period. If there are particular needs that need to be addressed, then I'd be encouraging those people to make contact through SA Health, through the exemptions portal, and we'll work with those families to make sure that we can make those arrangements.
Commissioner, it would appear already that there's panic buying across the city, across the state. Is anyone going to listen to you? Honestly saying you're going to lock down for 6 days but don't panic buy. Do we have enough supply?
Look, this is one of the things we're concerned about. Providing this advice as early as possible to the community comes with some consequences, and I don't think everyone's going to listen. I do think people are going to flood our supermarkets. If you're going to go shopping, think about other people. Treat each other with respect and a bit of kindness. Everybody's in the same boat. Think about those people who are working in our supermarkets. They're doing it tough right now, and they are going to be inundated over the next few hours. And if we have to take action to protect those people, then we will do so.
The many hotels, all three of you for the last several weeks have basically told the public that it's safe, there's no problems, yet we've had multiple examples of the virus escaping, people being able to work, etc. Do you accept now that the program wasn't fit for purpose?
No, and I'll just challenge you on that too. We've had, as far as I'm aware, 3 instances of people who have contracted the virus as a result of their duties in a Medi hotel. We've been able to identify those people, and we have said from the outset that we have put a framework in place that enables us to participate in the national program to repatriate Australians who are trying to get back home. We have an obligation to do this. We've put a system in place that ensures as best as possible that we are managing the risk associated with bringing people back to Australia. We've never said that this is an airtight, guaranteed scenario. We have guaranteed that we are doing the best we can, and I think we've done that. Independent assessment of our Medi hotel facilities has verified that we have a benchmark standard level of management for COVID-19 Medi hotels. It's always been the case, given the highly infectious nature of this virus, that when we are engaging with people who potentially have the virus, there is a risk of it being transmitted, and that's what we're seeing today.
Commissioner, most people in the community would not probably currently have face masks readily available. Most of us didn't have them when we arrived at this press conference, but everyone's going to need them as of midnight tonight to leave the house. How do you propose that they get hold of them?
There are substantial supplies of face masks in South Australia. We are working through the logistics of making those available. I don't have the answer for that just yet. That's why it's not a mandatory requirement at this point in time. It's where possible you should wear a face mask, but we will be providing more information once we work out the logistics of making that supply available to South Australians across the board.
Just briefly back to the Premier. Thank you.
Yeah, some for the Premier, then we've got to get going, guys.
Premier, what are your thoughts and reflections on?
Well, I gave them at the beginning. I mean, the reality is you don't get a second chance to stop a second wave, and so we're throwing absolutely everything at this. We know that Victoria was in lockdown, substantial lockdown for 112 days. We want to have 6 days, this circuit breaker, so that we don't have much more pain down the track.
Have you spoken to the Prime Minister and the other premiers?
I've spoken with the Prime Minister, I've spoken with the Governor of South Australia, the Leader of the Opposition, of course my Cabinet colleagues. This was the strong advice from the Chief Executive, the Department of Health and Wellbeing and our Public Health Administration in South Australia. This is a particularly sneaky strain of this virus with a very highly contagious strain, a short incubation period and very little in the way of symptoms. If we don't get on top of this very, very quickly, it can get away from us, and that would be disastrous for us in South Australia. So, of course, we know that these restrictions are going to be very punishing on the people of South Australia, but we also know that we're doing it for the right reasons to stop a far harsher lockdown, which could come if we allow this virus to get away from us.
If we also look at what happened in New South Wales, we look at there was about 100 cases linked to, say, the Thai Rock cluster, etc., etc., and they didn't quite go to this level of restriction. So why have we chosen to do so?
Look, I think Professor Nicola Spurrier went through that in quite a lot of detail. Every strain needs to be dealt with in a different way. What we know with this strain is it's highly contagious. It's got a short incubation period with very limited symptoms. Don't forget, we really only found out about these infections because one family member went off and had themselves tested. The other people who were working did not even understand that they had the disease because they exhibited no symptoms whatsoever. So this is something that is really keeping our Public Health Administration awake at night, and that's why we have one chance, and we'll be throwing all resources at this because we know the consequences of getting this wrong.
What is the justification?
Professor comments on interstate travel. She said a short time ago she didn't want to be responsible for taking this virus into state. Are you surprised that Victoria and New South Wales haven't followed the other premiers?
Well, I
Close
think
the borders?
today the New South Wales Health Minister has gone out and said really only essential travel, and I think that was also other jurisdictions as well who'd kept their borders open.
What's your justification for not being allowed to go out and even exercise? Is that not risky of leading to a mental health kind of crisis?
Look, there is an exemptions process, but in this instance we are really asking the people of South Australia to join with us on this mighty quest to stop this disease in its tracks. We want to stamp it out before it takes hold in South Australia and ruins our economy. We've got one chance at this. We know that the incubation cycle is extraordinarily short, so we do need to stamp it out now before it gets into larger and larger rings. We, as of yesterday, had 4,000 people who were in home quarantine. We know that that would be significantly larger. If we leave this for another 24 hours, 48 hours or beyond, we will be putting a huge number of people into quarantine. This will overwhelm our health system here in South Australia and more broadly across the country, and this is why we are taking this swift and decisive action to keep our state safe and strong.
Premier, what your conversations without going into the private nature of it with the Prime Minister, what help was offered and what help is coming on the way? Look,
the Prime Minister has been outstanding. He's wanted to understand the specifics of the strain that we have in South Australia. He's kept in contact during his trip to Japan to meet with Prime Minister Suga, a very important meeting for Australia, but he's been constantly on the phone. I've been on the phone to the Deputy Prime Minister as well. They understand the situation that we have here in South Australia. They're supportive of everything that we are doing and wanting to make sure that we can get through this as quickly as possible. The Prime Minister offered the strong support of the Australian Defence Force, who have been outstanding in their support for South Australia this year. Firstly, of course, with the bushfires, then with our border control and our quarantine hotel control here in South Australia. In fact, they were standing down staff at this point in time when we, of course, needed to make a further request. So we did that through the ComDis plan protocol, which exists between states and the ADF, and the Commonwealth was forthcoming immediately with their support. We're very grateful for that.
Panic buying. What's your message to the community? We're seeing floods of people already at supermarkets and retail.
Look, what I can say is that we are keeping our supermarkets open in South Australia. There is no point in getting off to the supermarket this afternoon. This will be the one opportunity for people to get out and go and get their groceries and their essential items at supermarkets, at pharmacies, medical facilities. So there is no point in racing off this afternoon. Supermarkets and the supply lines that support those supermarkets will be remaining open.
So
Premier, how are you
just going to extend shopping hours like you did during the first wave?
Look, we will consider that. It's not something that we've considered already this morning.
How are you deciding who is an essential worker?
Sorry?
How are you deciding who is considered an
there
essential
will be
worker?
directions. The Police Commissioner has given an indication of what they're going to be. Those directions will be documented and come into force as of midnight tonight. But rather than sit down and document them out ahead of this press conference, it was important for us to send a very strong and decisive message to the people of South Australia that we need to work in partnership. We need to work very swiftly. We've got to take action. Time is of the essence. We have got time to stamp out this second wave, and we know the consequences if we don't get this right. And so we're calling upon every South Australian to join with us in stamping out this virus over the next 6 days.
Premier, can I just clarify, are masks mandatory when people go outside, and how long are you giving them to obtain a mask as well?
So as the Police Commissioner has just outlined only a few moments ago, that won't be part of the direction because it will take some time for people to get provisions of those masks. We did provide strong public health advice on Monday when social distancing couldn't be maintained, that we were asking people to wear those masks, especially on public transport, but it is not part of that direction. Ultimately, it could become part of that direction, so we are encouraging people to get hold of those masks. They are a good line of defence, but the most important one is to stay at home. Stay at home. By doing this, we will have the very best chance possible of stamping out this cluster. Thank you very much.
Thank you. Wow. Are we essential workers?
Yeah, yeah, we are.